Thanks for joining us on a day packed with meetings, Representative Dr. Clark. Let's begin with the issue, which is the lens for Georgia Win-List endorsements, reproductive freedom. You are particularly well suited for such a discussion because you have a PhD in microbiology from Emory University and teach nursing. In fact, the young women in your classes have never known a time when abortion was not safe and legal in Georgia. Republican-sponsored SB 351 would make it far more difficult for women in Georgia to receive the pills now available nationally by mail and used for early abortions. Please explain how these pills are currently used and what this bill proposes before a prescription could be filled in Georgia.
So first of all, thank you so much for everything that Georgia Win-List does for women seeking elected office, especially women who are champions for reproductive freedom. And so let's jump right into the bill, because I do think that this is an important bill actually being heard in committee today. You know, the pills that they're talking about, which we oftentimes refer to as the abortion pills, are medically induced abortions that can be done kind of in the privacy of your own home. They mimic very much the pills that would be used for inducing labor. And the purpose of these pills is to induce abortion in the earlier or the first trimester of pregnancy as an alternative to a surgical abortion that might be done in a doctor's office.
Now, this medical protocol has been available for many years and is widely used, correct? So
Correct.
There's no legitimate medical reason for these Republican proposed in-person visits and additional exams. Could you elaborate on what the Republicans are proposing?
So the Republicans have proposed an almost 30-page bill filled with a lot of information. So I'll start there. That really creates more and more barriers to access to this medical procedure, despite the fact that the FDA has recently approved these pills to be able to be mailed. So the FDA is going in the right direction when it comes to increasing access to medical care. Because let's be honest, an abortion is a procedure just like any other procedure, and this is medicine just like any other medicine. And the FDA has improved access to this. And what this bill seeks to do is to roll back that access. I do not think it is a coincidence that this bill, out of the 24 signers, 23 of them cannot get pregnant. They are all males. And, you know, there's one lone woman signer on this bill, and that is 1 out of 17 women in the Senate. So it's not like they didn't have women to choose from. It's just that women do not want this bill. And that is clear by the sponsorship in and of itself. We do not need bills that create barriers, that criminalize doctors, that reduce access to care, and again, you know, create just all these hurdles and hoops and forms and more red tape and bureaucracy and paperwork in order to stop people from having access to something that they may very well want or need.
Well, it also creates a waiting period, correct? And it creates the need for an ultrasound, which is not medically necessary by any stretch of the imagination.
Exactly. And I don't know how many people here have ever tried to get an appointment for an ultrasound, but depending on your medical provider, getting an ultrasound is not as simple as calling up, you know, a place and saying, hey, I'm coming in at noon to get this ultrasound for this procedure that I need. And we're talking about something that is time sensitive. So, you know, pregnancy is time sensitive, and the need for these types of procedures are also time sensitive. And so as you create these barriers, as you create these hoops, as you create all of these extra requirements, you're increasing the amount of time between when people have decided they might want to get this procedure and when they actually can get the procedure. And ultimately, again, you're reducing access to medical care, which is not what we should be legislating in Georgia.
Now, one provision of the bill specifically bans providing these pills on the campus of any public or private school, college, or university in the state. As a college professor, how do you react to this provision in particular?
Another barrier. So here we have the I'm kind of old, but I'm not so old that I don't remember being in college. And as a college student, and if any college students are listening today, you know that a lot of times you get your medical care from the health center on campus. So this is going to create, again, more barriers to access to healthcare that might be needed by students on our campuses. Why are we creating barriers? Why are these men, these 23 men, deciding that they're going to create barriers for the students on our campuses? Again, without really any regard to the fact that they don't really actually know what they're talking about. And I can tell you they don't know what they're talking about because the bill has so much misinformation that it's hard to even unpack all of the lies that are in the bill in and of itself. Yet we're using those lies to create more barriers. I've called them out on their lies before when they tried to do 481. I plan to continue to do that as this bill makes its way forward. And hopefully we can stop this by at least calling out the dishonesty that is going on when these legislators are putting these bills forward. They have no idea what they're talking about.
Well, I've got to say that I truly enjoy watching you call them out because it's fun to see. Now, one of the misconceptions is that this is such a dangerous procedure, but actually giving birth in Georgia is far more dangerous than an abortion procedure, correct?
That's correct. So here's the thing. The maternal mortality rate in the United States is one of the worst in the world. Then if you zoom into Georgia, it's even more worse. And then if you happen to be a Black woman in Georgia, you really have it bad. And so let's be honest, when we talk about the safety of different procedures, there are risks associated with any procedure, no matter what. There's risks with taking a Tylenol. But at the end of the day, there are just as many risks, if not more risk, of carrying a pregnancy to term in Georgia, especially for women of color. And so taking away an option from them, a medical option from them, does a disservice and could be very dangerous for women in Georgia.
Now, leaders in the House and Senate, including Speaker Ralston and Lieutenant Governor Duncan, have suggested this bill will not reach the floor of the House or Senate this session. However, anything can happen between now and sine die. How should those who oppose this bill make their opinions known?
So one of the first things I will say is follow the groups that are following these bills so you know when these bills are being heard in committee and where the bills are in the process. So currently the bill is being heard today, actually, in the Senate, on the Senate side. If it passes out of committee, which is a possibility, then there's no guarantee that it will not be called up for a vote on the Senate floor. So if it's in the Senate, the people that you really need to be concerned with are the members of the committees in which the bill is in. And once it makes it to the floor, you need to be contacting the lieutenant governor and also your own legislator, your own state senator. If the bill passes in the Senate, then it can go to the House, in which case you will need to follow the bill in the House, contacting the committee members in the House as well as contacting the Speaker of the House. And ultimately, no matter what, people should be contacting the governor, because at the end of the day, if this does make it through the entire process, it is his signature that will cause this bill to be enacted. So make those calls, follow the groups that are following these bills, because they are putting out really good information, and make sure that you know who to call, when to call, where to call, and what to say. And I think that will be helpful in letting the people in our legislature know and letting the governor know where we stand when it comes to standing up for reproductive rights here in Georgia.
Thank you. Now, shifting gears a bit, one of the most hotly debated topics in recent days has been the maps for Gwinnett County Commission elections. Although Cobb County Republicans and others are now also taking a page from the Gwinnett Republican playbook, could you please explain how House Republicans bypassed the democratically drawn and publicly vetted maps for Gwinnett County Commission District, and how this process flaunts decades of legislative protocol for local matters?
So I want to first start off by saying, when this first happened, there was so much confusion about what was going on, because it has never happened before. And I actually went to our research office and I asked them, when was the last time this ever happened? They had there are no records in the digital archives, and they said, if you want to try to find something, you can look into the physical archives, but you got to go sit in a room and like comb through all the records. So this is something that doesn't happen. So what am I talking about? What doesn't happen? Local redistricting normally is a process where a local delegation will go through the local process, where as long as a majority of the people within that delegation agree on the legislation, there is something called a courtesy, or a local courtesy, where the whole House and the whole Senate says, well, if everybody if everyone in that delegation, or the majority of that delegation, is okay with it, then we will defer to that delegation. That's the way it's always been, especially with redistricting. But in Gwinnett County in 2020, voters turned out in historic numbers, and they made history. And for the first time in a long time, we have a 100% Democratic Board of Commissioners, and that's in over 3 decades. And our Board of Commissioners is also 100% people of color. So we are making history up here in Gwinnett County, and I'm very happy about that. But there are people who are not happy about that at all. And so what they did was they used legislative loopholes, backroom deals, and basically in secret drew their own maps that created basically a northern district and then divided up the south part of Gwinnett. So they created this northern district, which demographically, the white population is the highest, or the majority voting block. And by majority, I mean over 50% of the voters in this northern district that were created are white voters. And you might say, well, why does that matter? Why is race always a thing? Well, the Voting Rights Act of 1965 says that race is definitely a thing that you need to take into account when redistricting, because of the ills of our historic past. Along with that, you also have to take into account that the growth of Gwinnett moved in a completely opposite direction. All demographics saw an increase in their numbers, except for white voters, where we saw a 12% decrease in the number of white residents in Gwinnett County. So to create this district, you really had to go out of your way to create a majority white district in Gwinnett County. And that's what was done by the Republicans. And that is the map that they have tried to shove down our throats again through legislative loopholes and corrupt backroom deals.
Now, very quickly, one of the debate points and the irony of it was that Republicans said they were preserving communities of interest, yet their maps carved up existing cities and divided communities of color. Could you elaborate just briefly?
Their map divides up the Asian population. Their map divides up the Hispanic population for no reason at all. It splits our county seat, the place where our courthouse is, our where our justice center is. It splits that city into 3 commission districts. It splits another city in half, and again, north and south. And it didn't have to be this way. Our Board of Commissioners drew a map that prioritized what the community asked for, which was to keep cities together. That was one of the #1 priorities that the people of Gwinnett, Democrat and Republican, asked for in drawing the maps, and the Republican maps did the exact opposite and decided to split cities in an effort to, again, create this district, which they had to go out of their way to do, that was more Republican, more, quote, conservative in their own words, and by the numbers, more white.
Thank you so much. We're also going to follow the school board proposal, but we're running out of time. But we so appreciate your joining us, Representative Dr. Clark. We know that Gwinnett voters can count on you to continue expressing their concerns eloquently and effectively in the General Assembly.